Hello, this is Dr. Maury Markman from City of Hope. And in our last segment, I introduced the topic of hope and the importance of hope, the relevance of hope in the setting of a diagnosis of cancer. Now, there's certainly no disagreement that I'm aware of among anyone about the importance of hope in general and even in the diagnosis of cancer and the importance of support from family, clergy, friends, etc. The concern comes with the potential that this hope can progress to the point of unrealistic expectations. Some have used the term false hope, which I personally reject. I don't know how hope in this context can be false, but the intent is clear, that to say that, you have to deal realistically, even if optimistically, with the cancer diagnosis. And if you go too far, that potential exists for decisions that one might make in their life that are not necessarily in their best interests because of this focus on hope. Obviously, the thought could be that if someone was diagnosed with an advanced cancer where there wasn't good therapeutic options, either because of the state of the cancer or their comorbidities and the state of the cancer, where in fact they've had already the best therapies, and we don't have good therapies, and would argue that there aren't potentially clinical trials available, they still want to proceed with aggressive type treatments that are far more likely to cause harm than any benefit. Patients will not, under such circumstances, consider transition to a palliative care / end of care strategy. Again, these things might be available to really help them, but because of their focus on hope, they are unwilling, even with potentially the support of their family, to make that transition such that at the end of the day, they are actually harmed. There's certainly examples of that. Certainly all clinicians in the oncology sphere are aware of sometimes the difficulty of the transition. There's data that suggests, for example, the immunotherapy, the new immunotherapy for many tumor types. There's an increased use of these agents, potentially even within the last month of a patient's life, literally as they were progressing significantly, problems with comorbidities that might make the situation with any further therapy worse. They would want those therapies. Again, it's not a question of right or wrong. It's a question of having potentially realistic discussions with their providers. Does this make sense? Again, you can never make too broad a comment about this, but certainly the progression of cancer does occur. And that transition to optimize the quality of life is relevant. So this concern of that kind of unrealistic hope is real, is fair. Even within the research sphere, there's a term that has come up of therapeutic misconception, a topic upon itself, but certainly that the question of phase 1 trials, as historically done, where they weren't molecularly targeted, the likelihood of benefit being small, patients thinking that there might be a high chance of cure in a phase 1 setting, or independent of the phase 1 trials. Patients could be asked with very advanced cancer, what's the goal of therapy? The goal is cure, when we didn't have any such options, or even if they were on second or third line therapies, where maybe there's a real chance for palliation, but the opportunity for cure was small. Still, surveys suggesting a large percentage of patients may state the goal is cure. When asked the question, is that in the best interest of the patients? It's not for the doctor to decide, but this question is fair to ask about, can this hope, this focus on hope, potentially be harmful to that individual patient? This is really an individual discussion, and there's got to be an open discussion among the patient, by the patient, the family, their advisors, and the clinicians about where a patient may be at a particular point in time. This is not to take away hope, but to potentially be certain that there isn't harm done because of an inability to look at facts objectively. On the other hand, we're going to take a different view of this particular question in the final segment on hope. And I thank you for your attention.